Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi-Spa. Welcome to another one of our episodes of our Facebook Live. It seemed like a couple of days ago we were doing an event on the importance of sunscreen and protecting ourselves and our family from the harmful rays of the sun. And summer's gone and we are kicking off fall. So September has come and gone as well, and we are on the verge of moving right into October. Everybody knows that October is Breast Cancer Awareness Month, so we figured at Bellissimo, why not kick it off a week early? And we brought in a very special person who has started a very special company, and her name is Lisa Lurie, and you're going to get to know her very well tonight. But Lisa is a breast cancer survivor herself, and just a few years ago, she and a friend co-founded Cancer Be Glammed, which is a company that helps women kind of maintain their self-esteem, their self-image, their dignity, and most of all their style. That's battling exactly right. Any cancer. So as Lisa's battled breast cancer, your friend had battled liver cancer.
Yes, that's correct.
And
my business
so
partner and friend.
Yeah, yes. And so I want you to be able to meet Lisa. Ella and I have gotten to know her over the past year. She's a tremendously skilled person in what she does, but she's been through it, and you'll love her as much as we do. So without further ado, welcome. I'm so happy you're here. It's
Jeff,
really an honor to have you here.
It's an honor to be here, and I'm very passionate about talking about recovery.
Good.
So fire away.
Good. Well, I'm going to have you fire away. So I want you to tell them your story, how it started, and how Cancer Be Glammed just took off.
Absolutely. I was diagnosed with invasive ductal breast cancer 10 years ago, and I had 2 weeks between my diagnosis and a double mastectomy. And you know, any person who hears the words, "you have cancer," the immediate focus goes to all your medical needs, you know, trying to figure out your insurance, how you're going to manage, as I like to say, feed, carpool, and clothe your family, and that's as it should be. So much focus is on that I received very little support in trying to cope with the way my body looked after a double mastectomy, how to cope with hair loss because I had chemotherapy, and I was totally unprepared to deal with the visible appearance-related physical side effects of cancer. And you know, I kept thinking there has to be a better way. You know, I woke up after my double mastectomy, took my bandages were taken off, and I didn't choose to have reconstruction, and you just stand there, and I think it's one of those moments in a person's life that, you know, it was so devastating and so overwhelming that I didn't know how to get on with my life. Like, I knew how to dress to be a wife, a mother, a career woman, you know, all the sort of roles we put ourselves into. Now I didn't know how to pull it together to maintain my identity and sense of self as a cancer patient.
Was it the cancer that kind of made you feel that way, or was it the loss of the breast and the breast tissue?
I think it's all of that, Jeff. I think you can't separate out the thought of having cancer and what that your body, you sort of feel out of control because you can't control what's going to happen from the medical end. I mean, you can take care of yourself and have good nutrition and do things to make yourself well, but you're really in the doctor's hands. So you've lost that element of control. And then, you know, we live in a world where so many people, there's so much emphasis on physical beauty, and particularly for women with their breasts. And to wake up and just no longer have breasts anymore and not know how to dress. I wasn't prepared for the fact that I had lymph node surgery and I couldn't lift my arm, and arm was in a tremendous amount of pain. There's so many unknowns that women face that I wanted to say, hey, okay, we're gonna hold your hand through this. We're gonna help you deal with all the things we actually have on our website, a shopping checklist that's called What the Doctor Didn't Order,
right.
Because obviously you're going to focus on the medical things, and you know, I want to help women focus on the things that let them get dressed, let them get on with their life, so when they have that terrifying moment of seeing how cancer has changed their body, they know that they can put the pieces back together, feel good, feel well, feel good about themselves, and get on with their life.
I think from the medical standpoint, I think that's a hard thing sometimes for surgeons
Believe it.
and the medical doctors, the oncologists, that we're seeing it all the time, and we have to always remember it's not routine for that person.
Yes.
And we do focus
Yes.
on the techniques and what do we need to do to give longevity. And in my case, as a plastic surgeon,
Yes.
I start focusing, and ladies that have come to know me
Mhm.
through breast cancer, I talk about my role is to give as much quality of life as I can. And again, it's from a technique. It's building a breast,
Yes.
and a woman's femininity is really built around her breast. And so now that very essence on
Yes.
on different levels is gone. But I think as a medical community, we do better in an orthopedic situation where we're doing hip replacements, knee replacements, shoulder replacements now are growing rapidly. And I think we have occupational therapists and physical
Yes.
therapists that help people
That's
move,
true.
and we know
Yes.
we're going to replace a limb or a joint.
Yes.
This is what we need to do to help them do the activities of daily living.
Right.
But when you remove something as a breast that is not needed for the activities of daily living,
Yes.
but is your whole being
Absolutely.
from the psychological standpoint,
Yes.
the physical standpoint, I think as the medical community, we don't know what to do with that. And so we can't really recommend. So that's why what you're doing is so tremendous. So, I'll be quiet. And I want you to
I
keep going
don't
with
want
that
you to be
because
quiet. But
that's
you mentioned something, Jeff, when we were talking, if I can interject for a second, is, cancer is so personal.
right.
To each person, there are different options, different recovery choices, whether to have reconstructive surgery or not. And I thought really appreciated what you said about your role as the plastic surgeon. And I think, that's helpful for women to hear because you're the type of person they should look for. So if you could tell, I think it's worthwhile to tell people a little bit about that.
Well, I think that my feeling is when we do every time I see a patient in consultation, when we do our October breast cancer awareness, my feeling is I don't think, again, we don't do as well as a medical community and a surgical community to make it aware that my feeling is that every woman should hear about breast reconstruction.
Totally agree.
And that doesn't mean you need to do it or you have to do it. And again, you chose not to, and it worked
Yes.
okay for you. And so
Yes.
my feeling is not to have a woman come in and I talk her into breast reconstruction, because
Right.
that
And
may
I
not
think
be
that's
the
important.
right thing for them.
Exactly.
But you as a
Exactly.
woman should have the choice
Right.
whether to do it or not to do it. So you should at least hear the information so that you can make an educated decision about your life.
Totally agree.
And as the medical community, it's nice for me as sort of bridging the gap between the guys, putting everything back
Yes,
together,
yes.
but also understanding the psychological component
Totally,
of
Jeff.
the
Yes.
quality of life. But teaming up, it's a team approach, the surgeons, the oncologists, the medical doctors, but also people like you that you're on the other side. Okay, how are we going to make it easier to
Totally.
get back in?
Exactly.
You understand, you've been through it. So what are the clothing? What are the things that we can do to assimilate you, just like we would do with somebody with a walker, a
Yes.
cane?
Yes.
There's different types because of what they need from a joint replacement. So
Absolutely.
I want you to
I think,
explain
Jeff,
what you've kind of gone through with
Okay,
that.
will do. And I think you just made a good, what you said is really great. Because the education, see, part of the reason I opted not to have reconstructive surgery is I had 2 weeks between my diagnosis. I was a busy mother, I worked, and my double mastectomy. And it's the kind of shared decision-making you're talking about, where you can come to a doctor like you and find out all the options and really be educated so you can make an educated decision. It is so important. So I thank you for that, because I think that is really important for anyone moving on to the next step. And I didn't have a good education and enough resources at the time to help me make that decision. So what you do is really valuable.
Well, I appreciate it. So we can work together to change
Excellent. Yes.
the dogma that's out there right now.
Yes. Well, so what ended up happening is I started a company called Cancer Be Glammed, sort of tongue-in-cheek, and our tagline is Recover in Style. And we're talking about lifestyle, being, how to I can't, we have okay, so it was that, let me backtrack a little before I trip over my tongue. So we started this company, Cancer Be Glammed, and we really wanted to provide women with options. We're not saying this is how you should dress or you need to feel pressure on yourself, but I wanted women to know if they went for this type of surgery, here's some great recovery options. If they're having a breast surgery, here's some great companies they can go to for reconstruction. If you're choosing to stay flat, here's some great clothing that you can wear without wearing a prosthetic, which I don't like to call anything a prosthetic. I mean, that chills me, breast prostheses, breast shapers. So that's what we started to do. And so I started to pull together a curated collection of clothing for every step of the way, from diagnosis, surgery, chemo, radiation, and transitioning into survivorship. So I'll show you just a few of the things I brought. This is from a company called Wrapped in Love, and I love this because after surgery, one of the most difficult things for women is drains. And so this is a really nice cape that has the drain pockets built in, and I think that's really valuable for women. And then when you're done with the drain pockets, you can take them out. And this is great to wear to chemotherapy as well, because often women are put into menopause. And so it's hot, cold, that drove me crazy. So this wonderful cape, we recommend that you have something like this that you can take on and off very easily.
You can easily layer with it.
Definitely. And as we were talking about how I wasn't prepared to wake up and not be able to use my arms and to have such a sore chest, etc. This is a company, and I'm going to do some name dropping, Juliana Rancic, and from the Fashion Police, and Robin Roberts wore this shirt. It's a Heal and Comfort shirt, and it is designed for post-surgical, post-breast surgery or lung surgery. And you have easy to open Velcro. The material is a wicking material.
That's nice.
Feel that. So if you're sweating and miserable, it's very light. It can be washed very easily, and it has pockets as well, so you can keep your drains in there. And when I was diagnosed, a lot of doctors recommended with drains, pin them to your nightgown, pin them, and it ruins your clothing, and also that seems so cumbersome.
Yeah.
So today there's a lot of clothing there's companies that have beautiful clothing that has pockets that you can hide, camisoles that have pockets for drains, there's great bras that have pockets, that have drain management things. So go on Cancer Be Glammed, not to just plug it, but we have a collection of all these companies because we've looked at all their products, worked with them, and you'll be able to find things like this.
Well, the little pockets for the bulbs, the drains are important. That again, bulbs, I tell patients, I use them for lots of different things, but they're necessary evils.
Totally.
And
right.
Again, from a medical standpoint, I need to put them in because I don't want to get a seroma. I'm draining this. And it's very logical.
Yes.
This is how we do it. But we consider, women and, for different surgeries, and guys have them, you just sort of have to deal with it, pin it to yourself, deal with it. But ladies, a lot of times they'll say, if I'm going to go back to work, or if I'm going to go do this, or I'm going to go to one of my kids, recitals, what am I going to do with these things? How do I hide them?
Right.
And you just say, well, I don't know, tuck them into your pants pocket.
Exactly.
But that's because we haven't thought that far ahead from a medical standpoint.
Right.
So these are nice because now instead of using those stupid safety pins, now you have something that's a little bit more fashionable.
And
that
there's
you can hide them.
camisoles today that are beautiful camisoles that have drain. I mean, that's the difference, I have to say, in 10 years. And almost all of these products, I mean, there's no reason for you to feel like you have to live I lived in my husband's sweatpants, my button-down top, and we even did a video called Burn Your Bra and toss out all those ugly mastectomy bras, because today there's so many more options. And my job is to educate women, just like you're talking about how they can move forward and continue to dress well, feel good when they're going through all of this.
And it's hard to feel feminine and stylish when you're wearing your husband's clothing.
Oh, please. And let me say this. I had a lot of sweatpant wearing, t-shirt, button-down shirt
but
wearing
that was your
days.
option.
But That's the thing. And I still have them, and that's great. But if you want to have an option to dress a little nicer, or have something that's more personal, like this is a wrap for radiation. I love this. It's from a company called Radiant Wrap, and it's a doctor-approved wrap, and it comes in a little bag, so you can put it on for radiation and have your own custom, almost like instead of that tired, boring, disgusting hospital gown, and slide it down for radiation. And it comes in a little custom bag, and you put it in your purse, your tote bag, your hospital bag, and take it with you, and at least it's yours.
Right.
You know, we're talking about the little things that make you feel so much better. And these are the kind of things.
Yeah, that's fantastic. What else do you have?
This is terrific, from a company called Rebound Wear, and I love this. It's for ports, it's port accessible, and you can snap it up and do a lot of different things with it, but I wanted to show you how easy it is to zip down and have your port. Yep, the whole sleeve can be open, so you can have, IV if you need to have an IV or anything else, and you can put it together in a lot of different ways to suit you.
See, the nice thing about this,
That's what's
again,
great.
thinking of a patient, when you're coming in for even dialysis patients,
Yes.
The thing that you
Yes.
can wear this while you're having that, and it's yours, like you said. I think there's nothing more comforting, but
Not
stripping you of your
depressing.
dignity than
You
putting
said
on one
it.
of those hospital
You said
gowns,
it.
because everybody
You
looks the
said
same.
it.
They don't cover everything.
They cover nothing.
I've
flashed everyone in a
right, I know women always joke that after having kids they don't have any else.
True,
they don't have any self-dignity anymore. But
that is very true.
What it is,
but
and again,
still.
you can have, you have those days where you're hot, you're
Totally.
cold, and so you can have this on. You can just open up what you need. You don't have to
Exactly.
expose yourself
Yes.
to get
Totally
to getting your
agree.
chemo and through the port and everything else. You can just
Exactly.
section it off. I think it's a great
And what's
idea.
so neat about most of these products that I'm showing you today, and we have a collection. If you go on our website, cancerbeglammed.com, you'll get to see everything. But a lot of the products were made by survivors themselves, and that's something that we feel really strongly about at Cancer Be Glammed. They're called, survivor entrepreneurs or cancer entrepreneurs, but they're really people, it's either them or their family that recognized a need that person didn't have what they needed, so they went on to create these products, these fantastic products, including this one, which there's a wonderful woman, her name is Karen McDonald, and she has this whole line called Wrapped in Love. And I love this because, and she's matching headscarves and totes and stuff, because this is so lightweight. Isn't that pretty?
Yeah.
And she has a bunch of kimonos and things that you can wear this to chemo. If company comes to visit you in bed, it's not like a Doris Day bed jacket kind of thing going on, It's very pretty, and you can wear it out of the house to a doctor's appointment, as well as just putting it over your bandages and feeling great about how you look when company comes.
And it's not cumbersome that you have a lot of buttons and
No, everything is designed really smartly, with most of these products, with comfort and we like to call it practical yet fashionable products, because that's really what they are.
Yeah, it's fantastic. I mean, I noticed that you have the lymphedema sleeve on.
Yes,
So then they've
thank
come a
you
long
for
ways.
mentioning that.
They used to almost
Yes.
look like a wetsuit.
And they still
years
do.
ago, and so, and again,
Yes.
it's such a, now that we're doing a slightly different mastectomy
Yes.
and, sentinel lymph node dissection, we're not taking it and cleaning
Yes.
out all the lymph nodes in the
Yes.
office as, our mothers
Makes
would
a
have
big
gone through and everything else. So
difference, yes.
we have much less lymphedema, but
Which
it's
is
still
great.
present.
Yes.
And so now that the way that some of the radiation is being
Yes.
administered, and sometimes you have to have a boost to the armpit, where even if you don't take out all of the lymph
Yes.
nodes now, but you have some
Yes.
scarring in there, so
Yeah.
the lymphedema, is still present. So
Yes.
you have something again that's more fashionable than
Totally.
those brown, thick.
Oh, please.
You know, things were,
They,
you know,
like
and they
you
would
have
zip up.
burns or,
Right.
yes.
And as a burn surgeon, that's what my patients had to have.
Yes,
They weren't
understood.
fashionable,
No.
but with this, again, there are ladies that have to wear them all the time.
I have to
multiple
wear
patients
them
like
quite
that.
a bit, and I wear it for travel or for exercise. And this company is so fantastic. It's called Lymphedivas. They have, you can get sleeves and gauntlets with Swarovski, I can never say the word, Swarovski crystals. You can get denim. They do art on these sleeves, and they're beautiful.
Right.
And you know, instead of people looking at you, in the beginning I had the type of sleeves that you're talking about that look like an ace bandage, and
Right.
people are trying to look away, they want to ask you what's wrong, but they're not going to. And now I have one that is tattoos, and people think I actually have tattoos up my arm. I'm like, no, that's a Lymphediva sleeve. But I agree with you. It's like I said, these sorts of things, you can't take it back. You can't undo what has happened when you've had cancer, but you can do things to at least make yourself feel better. And that's
And
really
it is, it's the
important.
little things, because the big things you can't control,
Not
and that's
at
just
all.
about everything in
Not
life.
at
As we
all.
get older and
Exactly.
more into adulthood, you see that.
Yes,
But
clearly.
with this, it makes a big difference.
It does make, and that's, you know, I've been talking to a lot of oncology nurses and oncology social workers and patients, and really, there has to be more emphasis on what they call the psychosocial services for women. That, you know, cancer recovery doesn't end when you're through the treatment and surgery. And now I think doctors are recognizing, because they talk about survivorship, you know, you have to be able to transition into living your life.
Right.
And I'm always going to have lymphedema, and I'm always going to have other things. It's, you know, clearly in my case, because I opted not to have reconstructive surgery, there's other things that they'll always be a part of my cancer experience, even though my cancer is gone.
Right, and I think
Hopefully
the hardest thing that we battle is when you think about all the other, even our burn patients that, you know, we have occupational therapists, physical therapists, and again,
Yes.
there's nothing that, I mean, burns are, again, not just the skin, it goes all the way down psychologically
Absolutely.
to the, I mean, I always said to the bone marrow. It was just a devastating injury. But they can have continued problems. But the biggest thing that I've seen with that, and again, going back to the orthopedic model, there are the things that those patients need from a physical standpoint are covered
Yes.
by insurance.
Yes.
When you're dealing with cancer, and any cancer, and you're back to your lifestyle, you have your
Yes,
company,
exactly.
you know, you and your husband
Yes.
Brian, you go out, you can do things. You
Kids,
don't
yes.
you don't have a lot of the scarring that a burn patient has, so you can
Yes.
able to do. The support sort of stops there, because the insurance companies are not into what do I need to help you
Right.
continue to maintain your
Right.
self-esteem as you
Yes.
move through the
Yes.
years as well.
Absolutely.
And so, you know, as you move through, you know, there's a lot of ladies now that, you know, in their 30s now developing breast cancer.
And
so,
younger.
right, and so
And
now
younger.
what happens when they move into their 40s and their kids are getting
Totally.
older? And so there's changes as we go through each stage of life.
Absolutely.
And we know as
Yes.
adults, even then, there's psychological changes that we sort of have to deal with. And so,
Yes.
but there's really no support for that. There's no support from the insurance companies to help you
I
kind of
know.
meander through
I
those
know.
waters. So, but the one thing is that the breast cancer groups do a great job
There
of
are
keeping
so
keeping
many
you ladies together.
fantastic organizations in Pittsburgh and nationally. I'm headed this week to Living Beyond Breast Cancer Conference in Philadelphia, and it'll be 200 to 300 women at all stages
Right.
with great support with doctors and programs,
Right.
and to talk about the whole spectrum. And you know, I was never a joiner. You know, like I wasn't the kind of person that said, you know, I'd like to do sports and other things, but that would join a group. And people said to me, you know, you really ought to have somebody to talk to who understands what you're going through. And, you know, it took me a while to get my act together to do it, but I went to, at that time it was called Gilda's Club.
Mhm.
And, you know, I walked, now it's called our Clubhouse in Pittsburgh. I walked through the door and started talking to people. And I had been hadn't done that for a year, and I felt like I could put my bags down.
Right.
You know, my old luggage, and I could breathe because they just got it.
Right.
At Cancer Be Glammed, we get it.
Right.
And it's nice to have a community of women that you can talk to, reach out to. We have a site on our site where people can write and ask, you know, what's a good gift, what is a good, you know, having this kind of surgery, I want to do that. And so, you know, I would encourage people to talk to people because everybody needs someone who gets it, and whether it's a group or somebody in your community or a friend that has breast cancer, it's really helpful to have that kind of support.
There's no doubt about it, having the support system.
You mentioned on your site that you have like a recovery shopping list.
Yes.
You have different directions
Yes.
there to
At
help.
Cancer Be Glammed, our goal is to keep women informed and well educated. So we have lots of great blogs. We have one section called From One Mother to Another, so you can get advice from a lot of great moms. We have a section called Know and Tell, where we have other bloggers that blog about hair loss, you know, all the things that they've gone through, because we want this to be a community of women.
Right.
It's not my voice, it's not just my cancer experience. That's the whole goal, is to get women, and we advocate for this so much that you can pick up the pieces of your life, and that the fashion industry, et cetera, has to understand that we're real women.
Right.
We want access to real fashion, and we don't want to be second-class citizens.
Right.
And slowly that is changing. So on our website, we have a shopping directory with all these products. You can find where you are in the process. And then we opted not to be able to sell products on the site because we felt like that would make it too specific. You know, if you saw a shirt that you liked or a kimono that you liked, we didn't want to just have one. So we connect to the company, and then you get the option of seeing everything they have. And particularly for in the area of mastectomy reconstruction, you need a professional fitter. So we didn't want to, pretend that we were professional fitters. We're not. We're really educators, empowerment people, and that's what we strive to do. And then so many people kept asking me, what's a great gift to give someone? My coworker, my mother, is going through cancer. So we have a great gift section as well. That was all chosen by women in our cancer community that said this was really great, we enjoyed this, we love that. And it's just a real information source. And I'm going to show you our book, which we just launched our guidebook in June. It's called Cancer Be Glammed, Recover in Style. And some of the topics are pre-surgery smarts, radiation couture, get your chemo tote bag packed and ready. And the whole goal of it was we amassed all these tips and advice from across the cancer spectrum, was to we're hoping that hospitals and doctors are making a direct appeal. We want you to sponsor this and get this into your hospitals. It can go in a wellness packet, an information packet, but it gives every woman tips and advice from what to pack in the hospital, what to put in your chemo tote bag, what are your wig options, hair options, how you should dress for chemo, and then and for radiation. And it also talks about just lifestyle, how to battle fatigue, how to handle people who don't know how to handle you because you've got cancer, things like support. And this book features all women who are cancer survivors. They helped us put the book together, and it's sort of a one-stop about how you can have a better cancer
It's a tremendous
recovery.
booklet, and it's easy to read.
Thank you. That was the goal.
I think the biggest thing that you're talking about is it's the fear of the unknown. You don't know
Totally.
what it's going to be like to have
Totally.
chemotherapy. You don't know what it's going to be like to have a surgery.
Yes.
So
Yes.
this book to me is sort of the version of the book that was out, what to
What-
expect
I
when
knew
you're
you were gonna
expecting,
say
and
that. I knew
and
you
see,
were gonna
and
say that
everybody,
because,
every
yes,
every
that's
couple
what we
that
tell
gets
people.
pregnant, they read
And
those
that's
books,
the Bible,
and
they
it's
were
like,
great
oh,
books. I'm guilty of that.
But
And
you
what to do the first year.
Well, you feel like you're sort of prepared, even though it's
I
you
had
have
my
less control over
complaints.
that
I
infant.
never read ahead because I would have assumed the next month have exactly what they said.
Right.
But that's
but
what we
patients
jokingly
want to see
say
this,
that.
or potential patients, because
Yes.
they'll ask me, what should I wear?
Yes.
What should I wear to the surgery,
Yes.
even
Yes.
the surgery that I do that has nothing to do with breast cancer.
Yes.
You know, they want to know what's it going to be like that day. What's it going to be? I mean, how long am I going to be there? What's going, so we kind of go through that
very
to again
important.
to get rid of that unknown.
The unknown is terrifying. In this area, I mean, it's great to have some unknowns in life, what your kids are going to be like, but this is one area. You have, like you said it, have such little control that to have information that gives you control over this part of your life was really important to me. And that was really what Cancer Be Glammed was created to do. I mean, my dear friend Ellen, who sadly passed away from liver cancer, she was my partner, and these were two mothers sitting over, two women sitting over our kitchen table night after night, and then getting out to talk to people to say, if you could have one thing that really would help you get started, what would it be? And this is what we heard.
Yeah, it's tremendous. It really is.
Easy one stuff, like you said. What to expect? We say that. We even say that.
But it works, and I tell you, like I said, you're a tremendous person.
Thank you.
It's a phenomenal idea. It puts everything together at your fingertips. And,
That's the goal. Yes.
Again, I'm so happy that you came
you're
in
so
and
sweet.
help us
Thank
educate.
you.
So,
yes.
a couple things I want to say before we end here tonight is we are going to have, again, last year, I don't know if maybe some of you remember, some of you that are just tuning in, we had a panel of ladies that were breast cancer survivors, and we did it as a panel, and it was a great night. And we had ladies that had,
fantastic.
such as yourself, who did not have
fantastic.
reconstruction. We had some ladies that were
Yes.
had reconstruction, different styles of reconstruction, and we just sort of sat around like this and talked about it.
Yes.
And that's going to be on October 16th. I think that's our date, and so Lisa,
I'm coming.
we
they recruited me, but
twisted
I'm
her
gonna
arm off
volunteer,
the
see?
camera
Oh,
to get you in here.
hard.
So she's
So
going to be
pleased
part
to
of
do
that,
it.
and there's a couple of other people that we're lining up. So it's going to be a very special night, and that's going to be just in 3 weeks. The other news is that since it is fall and everybody loves pumpkin spice, Tara wanted me to mention that we're kicking off our pumpkin spice mask and in the spa. So please come by.
Come for that.
Everybody loves it. It's a great time of year.
I'm coming for that. Okay, put me down for that as well.
So listen, thank you again for following us tonight. Please go to cancerbeglammed.com. Check out the website. Anybody that you know that's going through cancer, take a look at it. It is a tremendous company. It's a tremendous booklet. You can follow us on www.Bellissimo Plastic Surgery. You can follow us on Facebook. Let's see, Twitter, Instagram. What else did I miss? YouTube. Okay. So I have my young ladies here keeping me in line with all the social media. So again, thank you, and we'll see you again on October 16th. Please put it on your calendar.
Thank you. Thanks for having me. It was great.
That was great for me
Loved
too.
it. Thank you.